today. So today we will be doing a foley insertion for you. Did you hear about that? Yes? Okay, awesome. Have you already been educated on this procedure? Yes? Okay, cool. Before I begin, I'm just going to verify your name and date of birth on your wristband here. Okay, and do you have any allergies that I should be aware of? No? Okay, your general physical condition looks good as well. Do you have any pain right now? No? Alright, awesome. So before I begin, I'm just going to prepare my workspace. I did some hand hygiene. I'm going to put on some gloves. And then I'm going to clean the table. Okay, and I'm going to let that air dry I'm going to let it air dry for 2 minutes so that proper disinfection occurs. I'm going to take off my gloves and then do some hand hygiene. And then I've gathered all my supplies and I'm going to place it on the table for easy access. And then now we are ready to prepare you for the cleaning portion of this procedure. Okay, Mrs. Doe, before the foley insertion, I have to clean your perineal area. So before I do that, I'm going to give you some privacy by closing the door and curtains. And then I'm going to help you spread your legs, and then I will clean your perineal area, and then that'll prepare us for the foley insertion, alright? If you feel any pain or discomfort, please let me know. I'm just giving you a warm blanket here so you don't get cold. And I'm going to do some hand hygiene, put on some gloves. And I have this, you're in the right position. I just have to externally rotate your thighs and spread your legs open. I'm going to place a chucks so that your bed doesn't get wet. And then now I'm ready to clean. So I have a tub of warm soap and water here. And I'm just going to clean from inner to outer labias using a different towel or a different side of the towel each time. Okay? Okay. The inner labias. Okay. And then right down the middle. Alright, you're all done. And then now I'm just going to pat it dry. And then I'm going to clean up this area. Okay, now I'm just going to dispose of the dirty gloves that I used to clean. Do some hand hygiene. Put on some new gloves. And I'm going to prepare my foley kit. Okay, I'm going to move these supplies here I'm going to move on the clean table for a bit. I'm going to open my foley kit. Careful to I'm just touching the corners using the no touch technique. And then I'm going to drop in my 10 ml syringe, drop in my CSG patch, and drop in my stat lock. Okay, I'm going to take this sterile drape and just place it over or under the patient's leg. I'm just going to drop it and then I can fix it later. I'm just touching the corners and putting it shiny side down. Okay, we're all done with that. Take my gloves off and I'm going to put on my sterile gloves and prepare the insides of my kit. Okay, putting on sterile gloves. Fixing my gloves now. Disposing of this to my side, and then now I can prepare my kit. I'm just going to remove the urine sample cup for later. And now I'm going to get the sterile water and attach it to the balloon port. I'm going to place it in the kit so I can use it later. And now I'm going to I'm going to use the lube syringe. Take the plunger off. Now I can take off this plastic cover that was covering the Foley catheter, disposing of that on the side, and then putting it into the lube. making sure that it doesn't go outside of the sterile box. And then I'm going to open my iodine swab sticks and place them into the thing so that I can have it for cleaning. And now I'm going to move this box to my patient's sterile drape. Okay. Okay, Miss Doe, now it's time for the Foley insertion. So it shouldn't be too uncomfortable, but if you're feeling any pain or discomfort, please let me know. I'll try to make it as quick and painless as possible for you, okay? So right now I'm just gonna clean her labia. So I'm gonna take my non-dominant hand and spread open her labia and use these iodine swab sticks to clean. So from that side, and then I'll dispose of it to my side. From this side, new swab sticks every time. From that labia, this labia, and then right down the middle. Okay, how was that, Mrs. Doe? Alright, you're doing great. So now I'm going to insert the catheter into your bladder. I'm going to ask you to take a deep breath for me, and then I'm going to insert it, okay? Alright, I'm going to get the catheter from my lube syringe. Are you ready, Miss Doe? Okay, 1, 2, 3, take a deep breath for me. Alright, and I'm advancing the catheter into your bladder. And I'm inserting it slowly until I see urine. So I see urine right now. So I'm just going to advance it like 1 to 2 more inches. And then stabilizing the tube with my dominant hand, I'm going to release with my non-dominant hand and insert or inflate the balloon with about 10 mLs of water. Okay, I'm inserting the balloon. And then now I'm getting rid of the syringe, and then I'm gonna tug it back a little bit and then see if I meet resistance. Alright, there's some resistance, which is good. Okay, and then now we're all done, Mrs. Doe. Now I just have to collect a urine sample from this Foley. So yeah, let me get that started because your doctor ordered a urine sample. So I'm going to get the CHG wipes from my sterile field. And then I'm going to scrub this port right here for about like 5 seconds. And then I'm going to attach this syringe, the sterile syringe, to this port and collect about 5 to 10 mLs of urine for your urine sample. And then I'm going to kink the tubing. I'm going to kink the tubing below the port. Okay. And now I'm just going to withdraw about 5 to 10 mLs of urine. And then I'll unscrew it from the port. Okay, and then now I'm going to take the urine sample cup over here, and without breaking sterile, I'm going to open the cup, making sure that I don't touch like the insides of it. And then I'm going to inject the urine into the sample cup, making sure that I don't splash or that my tube doesn't go into the cup. And then now that it's all in there, I'm going to screw the cup back. And there we go. Now we have a sterile sample of urine. Alright. And yeah, we're almost done. How was that? How did that feel, Mrs. Doe? Any pain or anything? Do you feel any uncomfortableness or discomfort? No? Okay, I'm just gonna unkink this tubing so that the proper urine flows through the tube. And now I'm just going to secure the tubing in place so that it doesn't move around and cause you discomfort, okay? Alright, so I'm going to get my stat lock and the skin prep pad. So first I'm going to open up the stat lock and place my tubing in to the stat lock, making sure that I put it in correctly. I'm putting the larger one for the larger tube and the smaller tube on the other side. And I'm securing that in place. And then I'm just going to take the skin prep pad from the kit, prep your upper thigh here. I'm going to be placing this on your anterior thigh. Okay. And now I will just be securing it on your thigh. Alright, now that it's secured on your thigh, I'm going to hang it on the bed frame of your bed, below your bladder. Okay, I'm going to take this foley bag and hang it on your bed frame below the bladder. And then the urine seems to be flowing properly. There's no kinks in the tubing or anything, which is good. Okay, now I can take off my, actually I'm going to clean up around here first. And throw away everything that I don't need anymore. And yeah, how did that go for you, Mrs. Doe? Any pain or discomfort? No? Okay. I'm going to take off my gloves, do some hand hygiene. And I'm going to put on some new gloves to help you put your gown back on and cover you with a new warm blanket. Alright, I'm going to help you with your gown. And then I got you a new warm blanket. I'm going to put your legs back into place. Okay, are you comfortable in this position, Mrs. Doe? Yes? Okay, your call light is right here. And then now I'm going to label your specimen cup with your name, your MRN number, and the date and time of the collection. And it's ready to get sent to the lab. Okay, and then now I can dispose of this kit as well on this table into the proper bin. Okay, do you have any questions or concerns before I leave, Miss Doe? Alright, use your call light whenever you need me. I'll be back to check up on you in a little bit, alright? Okay, cool. Now we're all done. I would document the date and time of the procedure, the patient's tolerance to the procedure, the catheter size that I use, and the description and the amount of urine that I collected. Hello, Mrs. Doe. My name is Andrea, and I'll be your nurse today. So the doctor ordered your foley catheter to be removed, which is awesome. So before I begin that procedure, I'm just going to verify your name and date of birth. Okay, and do you have any allergies that I should be aware of? No? Any pain right now? No? Okay, so your overall condition looks like it's getting better and you're in good physical condition right now. Did somebody get to explain the removal procedure to you? Yes, somebody already did? Alright, do you have any questions or concerns before I begin? No? Okay. So I'm just gonna take off your blanket. And I'm also gonna provide privacy by closing your doors and curtains are already closed. So I'm maintaining your privacy, and then I'm just gonna put this blanket over you so that you don't get cold. And then we can start the procedure. So I have all my supplies ready beside me. I have my 10 ml syringe, the chucks, and some gloves. Just gonna perform some hand hygiene. And yeah, I'm going to put on some gloves. And then I'm going to lay you in the supine position. You're laying down, which is good. And I'm going to externally rotate your thighs and spread your legs. Okay, and then now I'm going to place the chucks on your bed. Shiny slide down. And this is just in case any like urine comes out. I don't want the bed to get wet or your gown to get wet or something like that. Okay, and now I'm going to take off these gloves and then put on some new gloves. Okay, these are the new gloves. And I'm going to take my 10 ml syringe and drop it there. And I'm going to take an alcohol wipe and remove your stat lock. I'm going to slowly remove, just let me know if you have any pain. It could just be, it kind of feels like a little band-aid, you know. Okay, so I remove the stat lock. Okay, I remove the stat lock from the thigh. And then now I will deflate your balloon. So I'm going to take this syringe and I'm going to attach the syringe to the balloon catheter. And I'm going to try to get out as much water as I can from the balloon. It should be around 10 ml of water in there. Okay, I got most of the water out. I'm just going to remove that. Okay, so I'm just going to ask you to blow out, and then I'm going to take out the catheter. It shouldn't be painful or anything. It might just feel a little bit uncomfortable. But yeah, so I'm just going to have you blow out right now. Are you ready? Okay. I'm just going to, okay, blow out now. She's blowing out. I'm removing the catheter into the chucks. And now I can wrap it into the chucks. And you're all done, Mrs. Doe. Okay, awesome. And now I'm just going to take the Foley bag into the bathroom and empty it out and measure it and take a look at the urine left over. Are you feeling any pain, Mrs. Doe? Okay, and then once I'm done checking the urine out, I would dispose of it in the proper receptacle bin. So I did that, and now I'm just gonna take off my gloves and perform hand hygiene. And I'm just gonna check up on the patient, okay? Okay, and there was no resistance during the removal process, but if there was a resistance when pulling out the catheter, I would try to use the syringe to pull out more water from the balloon, or I would just leave it in place and call the provider. So did you feel any pain, Mrs. Doe? No, you seem to tolerate the procedure really well, just like the insertion. So that's good. So for the next 1 to 2 voids, we're gonna need to measure your urine. So I left a urine hat in your bathroom for you. So you can just use that whenever you need to urinate. And usually there's some stinging or burning sensations after removing the urinary catheter, so that's completely normal, and it should lessen with the next couple of voids. But please let me know if you're unable to pee or if there's increased pain or bleeding when you try to urinate, okay? Alright, I'm just gonna put your gown back on and put your blanket back on. Are you in a comfortable position? Yes? Okay, I have your call light there, and I'm gonna help you put your legs back together as well. Okay, if you have any questions or concerns, you can ring your call bell and I'll come right over, okay? Okay, awesome. So I would document the date and time of the removal, how the patient tolerated, the description and the amount of urine in the Foley bag, and educating the patient on, you know, the signs and symptoms of, like, after you remove the Foley, like the pain and stuff like that. And then, yeah, we're all done.